Alrighty, hello everyone, and welcome to the Effective Budgeting for Nonprofits session 1 of 2. So when you registered for this session, it should have automatically registered you for the second one. And our speaker today will be Amy Brinkley, and she's done some other sessions with us in the past. So we're definitely in for a treat today. Next slide, please. So a quick disclaimer before we get started, funding for this initiative was made possible by SAMHSA, but it is worth noting views expressed in these materials, resources we'll share out, things of that nature aren't official policies of DHHS or SAMHSA, things of that nature, and we're not going to mention specific endorsements either. So just being mindful of that. Next slide. So to think about intentions when we go into today's session, if we want addiction destigmatized, we need a language that's unified. And so keeping in mind the words that we use matter. We're going to be cautious when it comes to when we talk about disorders and things of that nature, because they are heavily stigmatized like substance use disorders. We just want to make sure when we're trying to assist individuals wherever they are in the continuum of recovery and things of that nature, that we're just being mindful of that. Next slide, please. And so a quick plug today, since I am a part of the Peer Recovery Center of Excellence, we want to let you know that if there's anything that kind of pops up as this presentation goes on, that maybe you would like to submit in a technical assistance request on something that we could deliver to you, whether that's connecting you to another community organization, or if there's a specific research article you need, or whatever the case may be, really, please let us know. And it's really helpful or easy to do, I would say. We're helpful in those aspects to where you submit in your TA request on our website. One of our TA managers will contact you just to discuss some of those items throughout, so that we have some action items and deliverables. We'll create an overall plan so that we can deliver your TA, and then we will help deliver whatever that TA is. And then you'll receive a survey to provide feedback. And that's always important for us, because if we keep getting the same kind of TA request, or individuals needing a resource, but it doesn't exist yet, or, an item of research that needs to be done that hasn't been, or it's, severely outdated, that's something helpful for us as a center, so that we can go on and create that or add that as part of deliverables that we can do on your behalf. So please do not hesitate to reach out for us. No matter how little the TA could be, we are here to help and happy to. So please feel free to do that as well, especially if something gets sparked after today's presentation. Next slide, please. So just some last minute housekeeping before I turn it over to Amy. Again, this presentation is being recorded, but we strongly encourage you to join in with your video on if you can. Mine is not, because I'm having some internet issues today, but I am still here to help moderate in the chat, and Cindy and I will send in links, or continue to talk to you guys in the chat as well if there's items that are brought up. Just make sure to mute yourselves whenever myself, Amy, Cindy, etc. are speaking, just for ease. We want to capture everyone's content as best as we possibly can. Further, it's helpful when you speak, just go ahead and identify yourself by your name and work area to help others recognize you. We'd love for you guys to connect with one another in the chat as well, and really build up some of these skills that you're learning. During the presentation, please feel free to submit in questions and feedback in the chat box. Again, myself and Cindy will be monitoring it. And if there's something that we need to bring to Amy's attention or loop back in, we will definitely do that as well. Keep in mind, you will receive slides for this presentation via email after this takes place, so hang tight for that. Cindy did send in the chat the link to where previous presentations, slides, resources, etc. have been shared, so do know that that will get posted on our website too. Not too long after this, but just keep in mind we'll be adding that on there too. And lastly, we really do appreciate your feedback. We will be sending an evaluation link at the end of the second session. So this is a part 1 today. There will be a part 2, and then in about 2 weeks. So that is when we'll need the evaluation link done. And again, that just helps us make sure that we're providing proper, timely, etc. training, assistance and things of that nature. So that's very, very helpful to inform the work that we're doing and making sure that your voices are heard and we can support you in the amazing things that you're all doing. So please don't hesitate to do that either. But again, you won't need to until the next session. All right, next slide. I think this is where, yep. So I'll go ahead and hand it over to Amy so she can talk through these finer points. You are in great hands. Again, if you need anything, please write it in the chat. Otherwise, enjoy today's session. Amy, go ahead and take it away.
Thank you, Steph. Thank you, Cindy. Hello, everybody. So as you can see on our screen is the objectives for our time together today. Also have here for you a quick agenda of what we're going to be looking at and what we're going to be discussing today. So I'll do a little introduction of myself here in a moment, and then we'll do some level setting, and then we're going to talk through the basics of budgeting. And then there is a homework assignment that we will unpack during our next time together. So this is a 2-part session. And then we'll have a closing section. So in terms of the introduction, what I really wanted to do was start with 2 disclaimers. So my first disclaimer is I was sharing with Cindy and Steph right before we joined on the call that I've been having some internet issues. So I'm not anticipating any today. I usually don't have any issues, but I have been having some lately. So if I do, just hang tight. I will be getting right back in as soon as possible. And the second thing is that I recently had COVID. So if anybody's had COVID before, sometimes the brain fog lingers for a while. So if I seem like I'm stumbling over my words, I might actually be stumbling over my words because it's not coming out the way I'm wanting. Like I can see it in my head. I know exactly what I'm trying to say, but sometimes I feel like I'm still grasping for the right words that usually come easy. So 2 disclaimers for you guys today. So what I really did want to do though is, well, hold on a second. Why don't we hear from you? So if you can, please put your information in the chat. I think Steph mentioned that too. So you could put your name, your organization, your role, and what type of organization you work for in the chat. Feel free to include where you're located. And then while you guys are doing that, I will share a little bit about my own background. So I am a person with direct lived experience with both mental health and substance use recovery. By the grace of God, I have 14 years of continuous recovery. And I've also lost 3 brothers to suicide and my mother to an overdose. So I've got a significant amount of lived experience of trauma and dealing with systems from both the family member, the person receiving services, as well as a service provider in my background, I guess you could say. So I will share that I also spent time incarcerated. So I was actually sentenced to 14 years in the Department of Corrections in 2009 as a direct result of my substance use. Post incarceration, I got certified as a peer in the state of Indiana, and I went on to work for a community mental health center in Gary, Indiana. I was there for a number of years before I went on to work at the state mental health authority, which in Indiana, our SSA, or our single state authority, is the same as the state mental health authority. So in my role, I oversaw all of our mental health and substance use recovery related services. In my role in state government, I started out with a budget of about $750,000 and was able to move that budget in my 5 years to just over $10 million. And then that was also counting ARPA, or the American Rescue Plan Act, and CRRSA funds. So all of the COVID relief response funding that states got, I was able to access some of that. So some of that, 10 million sounds like a lot when it's a jump from 750, but self-disclosure is that a lot of that was one-time funding. But we still have a pretty big budget. We moved from 1 recovery community center in the whole state to almost 30. And we've built out regional recovery hub models from the ground up. And we've done a lot of really innovative things in the state of Indiana during my time there. Now, in January of last year, I moved on from my role in state government as Director of Recovery Support Services, and I went to work for the National Association of State Mental Health Program Directors. So basically what that means in layman's terms is I now work in the national federal space, providing technical assistance to the people who are in my role now that I used to be when I worked in state government. So it's just kind of a step up. And then I serve as a liaison between the federal and national organizations and the states. So still over recovery community efforts and services. And so definitely still in the recovery space. So that's my background and my day job. And I think one more equally important thing to note is that last year I started my own nonprofit called Paul's Plans Ministries. And that is in honor of my brother who took his life 5 days post-incarceration. And so we are a nonprofit, a faith-based nonprofit focused on helping people re-entering the community from a criminal justice setting, because we know that a lot of people who come out don't have a plan. They don't have a support system. They don't have access to the resources they need. So I have a little bit of the launching and starting a nonprofit from the ground up more recently as well. So just to kind of give you guys an idea of where I'm coming from and what my background is. So level setting, let's talk about level setting. So to help with level setting, I really wanted us to take a look at these two terms and the definitions for peer-run organizations and services according to SAMHSA. So recovery community organizations are grassroots, independent nonprofit organizations founded and led by the local recovery community. In addition to that, consumer operated businesses or services, as we've heard, often, this is the definition according to SAMHSA. I actually had to search for this to get this because I really wanted to make sure I added that in here. But consumer operated refers to an organization that is controlled and managed by mental health consumers and dedicated to improving mental health and ensuring that recovery support services are consumer driven. A consumer operated organization must have a board of directors comprised of more than 50% consumers. And we know, according to the Association of Recovery Community Organization, that's a requirement on that side as well. So I really wanted to share this. We did a presentation here with the Peer Recovery Center of Excellence a few weeks ago, and we talked a little bit about the needs assessment that was conducted. And I just want to dive back into that needs assessment. I don't know if we have some of the same people on the call, but I want to dive back into that for the purposes of today's conversation as well. So this survey was actually sent out to 210 peer-run recovery community organizations across the country in 2021. Interestingly enough, given the fact that 82% of people or organizations identified funding as a need, I particularly found it interesting that only 32% ranked financial management as a need, seeing as how good stewardship for sustainable funding is directly impacted by financial management skills. So I also wanted to point out on this screen that the focus group, so all interviewees of the focus groups identified inadequate funding and insecurity about the future of funding as a concern for their organization. And we'll put the links in the chat, and I can't see the chat. So Steph and Cindy, I'll need your guys' help with that. If something comes up in the chat that I need to be aware of, please. So some key observations in the report focused on high burnout rates due to lack of funding and immense investments of personal time. So for leaders in this space, there is an immense need to effectively manage funds quickly. Important to point out here too is that nationally, peer-run organizations are underfunded. That's not a huge surprise, I don't think, to most of us. We know that federal funding doesn't always reach the community level. And very few recovery community organizations have healthy, diversified funding streams. I will tell you that working in state government for 5 years, that the strongest organizations that I worked with always had multiple sources of income. They were never beholden to any one funding stream. And the absolute health of a recovery community organization will depend directly on its ability to diversify funding streams and build those partnerships. So it should always be a full-time job, just watching for new funding opportunities and focusing on building out partnerships and relationships with your funders, because you always want to magnify and build trust to keep the funding, as long as there is funding available, to keep that funding coming and keep the funder secure in their investment. So So here is the Recovery Community Organization Needs Assessment continued. Listed here are some of the key observations related to billing and generating revenue as well as staffing. So first thing to point out is the note that not every state allows for Medicaid as a reimbursement option for peer-run organizations. For peer services specifically, but lots of CCBHCs or certified community behavioral health clinics, as well as other providers, are willing to partner with peer organizations for the provision of the peer support. Two other things I wanted to point out is that requirement for CCBHCs to be considered certified as a community behavioral health clinic is the inclusion of peer services as an option to treatment. So this, by virtue, will be expanding employment opportunities for recovery organizations to partner with the CCBHCs. In addition to that, I think we're mostly all aware of the fact that peers are starting to show up in emergency departments, jails, prisons, reentry courts, other criminal justice locations. So recovery organizations should be considering looking for non-traditional funding opportunities with criminal justice partners, as well as Medicaid. So there's lots of opportunity out there, and we're going to unpack some of that. Before I move on, so last point here to make is that crisis services require that recovery needs get addressed, and the utilization of people with lived experience is part of the national and federal recommendations for crisis services. So this means this can look like peers in crisis lines, peers in mobile crisis teams, peers in crisis stabilization units and receiving facilities. But probably equally as important to note is that we're starting to see a rash of peer-led initiatives in these spaces as well. So you still got the broader ecosystem of crisis services, which includes peer warm lines and follow up with peers and community-based organizations responding and doing follow up. But in addition to that, we're just starting to see things like New York and Pennsylvania have peer-run crisis stabilization units. Peer respites are rapidly growing across nearly all states at this point. And if they're not there already, they're having discussions about it. So there are opportunities there for peer organizations to get involved and either be the service provider of the peer support, or be maybe even maybe provide the supervision or some other type of service, just to build out partnerships and be involved and generate some additional revenue. So in federal fiscal year 2023, the budget request from the White House is here. And so there was a $42.5 billion investment asked for, which was $3.2 billion more than the previous year. Focus areas for the funding are prevention, harm reduction, treatment, as well as recovery. We're going to unpack some of this. The overdose prevention strategy included investments in community resources to prevent harms related to substance use. In addition, the Center for Disease Control, or CDC, launched 4 different education campaigns on the dangers of fentanyl and risk of mixing drugs. In 2021, the Office of National Drug Control Policy announced 745 community coalitions in all 50 states had received $93 million through drug-free community program grants. So the question for us on this call is, was your organization one of those grantee recipients? And if not, we should be asking ourselves, why not? Because so ideally, this could be a learning opportunity for peer-run organizations to find out where that funding is going in your local community and find out how to tap into it. And what the requirements are, because that's going to look different in each community as well. So next slide. So as for the harm reduction space, we know that the American Rescue Plan included $30 million for harm reduction services. And the CDC and SAMHSA announced that federal funding is eligible to use for the purchase of fentanyl strips to curb overdose deaths. This could be innovative for peer-run organizations to use peers to educate and advocate within communities that they serve in. Also, the CDC and SAMHSA established $3 million in partnerships to leverage the CDC's National Harm Reduction TA Center. So another possible opportunity for peer-run organizations to get involved. I also know for a fact that the CDC's overdose to action grants promote the use of people with lived experience. I was actually asked to speak at an annual meeting for the CDC. The overdose to action grantee recipients had an annual meeting, and I was asked to come and share about peers and the implementation of peers and people with lived experience in overdose responses. So there's another opportunity for peers to get involved. Last but absolutely not least is that the recovery focus of the White House initiatives. We know that HHS prioritizes recovery in its new overdose prevention strategy through development of different types of support through the recovery workforce. So the American Rescue Plan invested almost $4 billion to allow Health and Human Services to expand access to mental health and substance use services. And in addition to that, the Department of Justice provided $94 million to adult reentry and recidivism reduction programs. In my state, which I live in Indiana, there's a push to create wraparound peer programs in all of our county jails to help people with access to peer support while they're incarcerated. But in addition to that, it's connection and follow-up care. So as the person transitions out of the jail, the wraparound peer support services follow that person and help them engage into community services before they release the person to help for that successful transition out. And now they're looking at partnering with the work release centers, and there's a new rash of nationally. I'm trying to think of it was Georgia. So Georgia is doing a very similar peer wraparound model right now in the prison system. So it's an in-reach program for peers to provide wraparound services to people while they're still in prison. So there's a lot of stuff happening around peer support with the criminal justice partners. So CDC also provided $300 million per year for the overdose to action grants, which talks significantly about the utilization of peers and carrying naloxone and doing outreach. So like I said, it's another unique opportunity for folks to consider getting involved. So level setting part 2. So I wanted to take a minute to look at how states are implementing funding for recovery support services and how states are identifying recovery support services. So what you'll see on your screen is a survey that we sent out to 44 states and territories in 2021, we're due for an update. We're probably going to send it out later this year. And we received 19 states and territories responses to the survey. And what we found was 20 distinct recovery support services types were reported from the states that were reportedly targeting 12 different types of populations in partnership with 12 different state agencies and systems across at least 8 different funding streams. And mind you, this is only from half of the states. So if we had gotten responses from all the states, that these numbers would be even broader. So what this means, for peer-run organizations is that these are 20 distinct types of recovery support services that a peer-run organization could be provided. This is 12 different populations that a recovery community organization could be targeting. This is 12 different state agencies and systems that a recovery community organization could be going to for funding. These are at least 8 different identified funding streams that recovery community organizations could be using to fund their recovery supports. So I hope that made sense. In addition, the survey showed the 8 different diversified funding streams. So 19 of the 19 states reportedly were using mental health block grant. 13 of the states were reportedly using substance abuse block grant. 17 states reported using state funds. 15 states reported using Medicaid. 16 were using state opioid response. 1 state was using local funds, and then 5 and 4 states identified other federal and state funding. Just a very general term there. So when states were asked what recovery support services does your state provide, what you can see here is they reported out hospital diversion programs, certified parent peer support, peer respite, And mind you, this is 2021. So a lot of this has changed, especially with the rollout of crisis services and 988 across the country. So these numbers would definitely be different when we run the survey later this year. But 11 states reported forensic peer support, 10 states were funding clubhouses, 12 states were talked about physical and wellness services as a recovery support. 9 states were funding sober social activities, 16 were funding their recovery housing, 11 identified recovery community centers, and then 19 of the 19 states reportedly were using funding for peer recovery supports and recovery coaching. So when states were asked, are you providing targeted recovery support services for any of the following specific populations? You kind of get an image on your screen. We left this section also open for others, so people could identify and list out populations that weren't listed here. I just didn't include that in this section, but we have a link I'm more than happy to share with you guys that has the full survey results. So if folks are interested, we can definitely share that. But you can see that 13 states were focusing on the criminal justice involved, 11 states were focusing on youth and young adults, at least 6 states were focusing on older adults, and so on and so on. So when states were, sorry, I was just reading my note real quick. So when states were asked, are you working with any of the following systems and or state agencies to provide recovery support services? What we found is that 18 states were partnering with community mental health centers. 14 states were partnering with the employment support agencies in their state. 12 states were reportedly partnering with the Department of Correction or the prison systems. 13 states were partnering with their housing and at-risk housing and homeless partners. And then state health departments, jails, child welfare, DCS, state hospitals, primary care partners, Department of Education, juvenile justice, victim services. So you'll note that the various state agencies and partnerships that states are using to implement recovery support services can hopefully impact and or help you achieve your goal within your peer organization.
Hey, Amy, real quick, a question
Yes.
in the chat on that previous slide, I believe, if I was capturing it correctly. They were just wondering if any collegiate recovery programs were funded, like in this data that you gathered.
You
Is that
know,
education was?
it's possible, and so that what you're pointing out is a weakness of our information, because when we listed out these as options, we just put education, but we should have separated collegiate recovery from education, because I think they're two different things. So that's something that we're going to update in our next series of sending out this survey. But we know that collegiate recovery programs are being funded. We just didn't necessarily capture that data clearly in this survey. Does that make sense?
Thank you, Amy. Yeah, that was the only question that I had captured thus far. So yeah, feel free to continue on with the presentation. Thank you.
Okay, thank you, Steph. Okay, so budgeting 101. So switching gears here, let's dive into my favorite topic. Haha. No, just kidding. It's not my favorite topic, but it's an important topic. It is an important topic. So budgeting is the process of preparing and overseeing a financial document that estimates income and expenses for a period of time. So for business owners, budgeting is a key skill for ensuring organizations and teams have the resources to execute their initiatives and reach their goals. So to be honest, when I worked at the state, I always knew when my vendors had strong financial management skills, because they had the financial answers to every question that I had on my budgets, on my budget sheet questions. And they were always transparent in sharing that with me with no hesitancy. Once we knew we could trust them, there was no hesitancy in increasing funding or continuing to fund services that they were providing when we could. And, you know, focusing on, I guess, my recommendation for everybody on this call, and even to myself as a nonprofit owner now, is to focus on building partnerships with your funders as well as your potential funders. And having strong budgeting skills and transparency practices around financial management of your organization is going to go a long way in securing funding as well as keeping funding. A basic budget consists of projected income and expenses, and budgets from previous periods can be compared to the company's financial allocation and performance, giving an idea of how close predictions were to the actual spend. I will be the first one to acknowledge a weakness, and this is a weakness for me, and it's practice. And practice, practice makes perfect, right? So it's an adjustment unless it's something that you've always been good with numbers. It's something that I personally have had to force myself to do. But I also have some experience on the other side of being the funder when I worked in state government. So I know how important these skills are and how important it is to hone in on these skills. So transparency practices and maintaining an accurate budget is crucial. So important to my disclaimer at the top of this slide is that I am not an accountant. And I don't even know that I would necessarily identify as a subject matter expert here, but there's a lot of materials out there that anybody could find. So there are several budgeting types that each prioritize different factors when approaching a financial plan. These include zero-based budgeting, which sets each item at $0, which sets each item at $0 at the start of periods before reallocating. The second one here is static budgeting or incremental based budgeting, which uses historical data. Then you have performance-based budgeting, which emphasizes the cash flow per unit of a product or service. Then you have activity-based budgeting, which starts with the company's goals and works backwards. And then you have value proposition budgeting, which assumes no line item should be included in the budget unless it directly provides value to the organization. And I wanted to note that the right budgeting type varies by company and situation. If your organization is in financial distress, the zero-based method may be the best fit as it starts from scratch each period. If you're interested in knowing more, I did include the resource where I pulled that information from. It's on the slides, and we'll make sure that we share the slides with you guys. So why is budgeting important? So it ensures resource availability. At its core, budgeting's primary function is to ensure an organization has enough resources to meet its goals, and funders want to know that they're investing and they're investing wisely with their money and that they can trust you. So number two is that it can help set and report on internal goals. Budgeting for an upcoming period isn't just about allocating spend, it's also about determining how much revenue is needed to reach your company's goals. It also helps prioritize projects. So a byproduct of the budgeting process is that it requires prioritizing projects and initiatives. And then when prioritizing, consider the potential return on investment for each project, how each aligns with your company's values and the extent they could impact broader financial goals. Now, I'll share a little bit of experience that I've had with this, with the nonprofit that I started last year. We got our first Department of Health grant. It was a $75,000 grant. We were contracting out, but because, and this is me just being very vulnerable and transparent here with you guys, that this has been a learning curve even for me, is I wasn't tracking the financial components the way that I should have been, because if I had, I would have noticed that we were going to be running out of funds to pay contractors. So then I was in violation of the contract that I had with our contractors, because I couldn't pay them as we had promised to pay them because we were over budgeting, and it was mismanagement on my part because I wasn't staying caught up on finances, and it was a huge learning curve, and it was a very, very, very stressful first 6 months, to put it lightly. And then what I highlighted here is that it can lead to financing opportunities. So if you work at a startup or are considering seeking outside investors, it's important to have documented budgetary information. So when deciding whether to fund a company, investors highly value its current, past, and predicted financial performance. And I am still learning. This is still a learning phase for me. I am still learning from our accountant how important this stuff is. And when we're filing taxes, for example, and when we filed it for our 501c3 status, these are all things that you have to submit with the paperwork, with the documentation. So having transparency and keeping track of your finances is going to be extremely important to maintaining a business. And last but not least here, it provides a pivotal plan. A budget is a financial roadmap for the upcoming period. If it goes according to plan, it shows how much should be earned and spent on specific items. So, and I've also got a resource there for you if you're interested. So here, some things to consider doing as a good rule of thumb for success includes what you're seeing on your screen, but it's not limited to conducting a needs assessment and listing out revenue sources to support the budget of the organization. You should also consider expense categories and keeping a comprehensive overview of the organization's financial needs. So needs assessment, revenue sources, and expense categories are three things that you need to consider when developing your budget. So a few things to definitely remember is to develop effective financial management practices to ensure effective monitoring of your organization's budget. So regularly review the financial statements, maintain up-to-date records, and conduct financial audits to ensure compliance and accountability. Also work with an accountant as needed and know that there are other resources, people, and organizations that can help with just about everything. So performance indicators and tracking are vitally important to the business as well. So work on developing performance indicators and metrics to assess the financial health and sustainability of your organization. And I would say partner. Recruit people to your board that have the skills that you need. I don't believe for one second that we have to be proficient experts in everything. Like I said, I'm not an accountant. I don't even know that I would necessarily consider myself a subject matter expert, but I know where to find them. I know how to navigate the relationships to get it done one step at a time. And so relationship building is your best friend. And then also just know when to outsource. For example, with the nonprofit that I started, Paul's Plan Ministries, I paid a third party to file all of our necessary paperwork for us. I hired an accountant to file our taxes and to file for the 501c3 status. For some people, that stuff comes easy. This is my first nonprofit startup. I had no idea where to start. So I started with the next best thing, and I started researching, and I started asking people, and I sit on other boards, and I started asking them questions about how they figured out certain things. And then I just started paying third-party organizations and accountants to do it for us. As a new business owner, I just didn't know what I didn't know. And so I was not opposed to financially paying for someone else to use their expertise to do it, because it needs to get done, and you have to have good financial practices. So also must remember to stay aware of existing grant and funding opportunities relevant for peer organizations. So stay plugged into the different types of services that other peer organizations in your state are offering, and find out, if you can, how they're funding them. Continuously search for new funding opportunities, submit grant applications, and build relationships with funders. You're going to keep hearing me say that because it's so vitally important. Also know that sustainability is always a plus for funders looking to put funding into a new project. One of the very first things that I would always get asked when starting a new project or funding a new vendor when I worked in state government, the first question always asked was, how are they going to sustain it? Because the state never wants to put money into something that they're going to be tied to supporting indefinitely. So there always needs to be, even if you don't have the full-blown plan, you need to at least be thinking about how you're going to build a sustainability plan. Just something that shows you're thinking long-term. So, okay, so also know that sustainability is always a plus for the funders looking to start looking to start putting funding into a project. Try to establish a contingency plan to address unexpected challenges or changes. and maintain reserves when possible. Always be thinking and considering the sustainability, and be ready to discuss it and answer questions there without getting defensive. And I feel like money is one of those topics that people aren't always comfortable with, and aren't always comfortable necessarily talking about or asking for funding. I learned to be comfortable with those conversations by working in state government. But if you don't have that lived experience, or you don't have that background, it's something that you just have to be intentional about making yourself comfortable. The best thing I ever learned from my sponsor was learn to be comfortable while being uncomfortable. So you just keep having the conversations and going out there and being awkward and being uncomfortable and asking the hard questions, and being open to having hard conversations until you are comfortable. And that's not always easy for us. So to summarize, financial budgeting is essential for peer-run organizations as it facilitates resource allocation, financial planning, decision-making, accountability, risk management, fundraising, and monitoring. Also, by adopting sound budget practices, your organization can enhance its financial stability and ability to fulfill its mission. So now I want to discuss some tools to help you be successful. So peer-run organizations should be aware of the following resources for effective financial management. Financial management software is the first one we'll discuss. So investing in financial management software can greatly assist you in streamlining your budget, accounting, and reporting process. So software like this can offer budget creation and monitoring, as well as invoicing, financial reporting, and integration with other systems. Nonprofit accounting standards and processes. All peer-run organizations should familiarize themselves with the accounting standards of nonprofits. Understanding the standards, such as the generally accepted accounting principles for nonprofits, ensures accurate financial reporting and compliance with legal requirements. Resources should be available online, and remember to follow your specific state's laws, policies, etc. for nonprofits. And I'll say what I said earlier, also partner with people that you know are experts in those areas, and listen to an accountant. Every organization has to have an accountant. So use your accountant. Financial literacy training for members of peer-run organizations is another tool to consider. So for complex financial matters, peer-run organizations may benefit from consulting with professional accountants or financial consultants with expertise in nonprofit finance. These professionals can provide guidance on budgeting, financial planning, compliance, tax matters, and strategic financial decision-making. This may be funding determinant, of course. So there are numerous resources available online that provide guidance and support specifically tailored to nonprofit financial management. There are nonprofit associations, foundations, and even government agencies are now getting into this space to offer educational materials, toolkits, webinars, and publications, all in an effort to help organizations navigate financial challenges and best practices. In addition, there are peer networks and communities that are resourceful. So connect with other peer-run organizations can be invaluable for sharing knowledge. Peer networks provide opportunities to learn from others facing similar financial challenges, exchange best practices, and access resources and support specific to the nonprofit sector. I know that this looks different in every community, in every state, in every territory. In the state of Indiana, when we launched the regional recovery hubs, one of the things that was a mandate was that all of the peer-run organizations had to come together for a monthly meeting and report out on successes and barriers. Why? Because that was their opportunity to share with each other things that are going well and things that we're all having challenge with. So we're all working towards the same goal of helping people, of expanding recovery support services, of building out peer support in their region, but we're all having different varying challenges that we can learn from each other on. So any type of network that you can get involved with, do so. Go to those meetings, because you never know what kind of a nugget of information or resource or funding opportunity or barrier busting opportunity that you're going to hear on one of those calls. So it's not, we live in a busy society where it's really hard to make those, to make those meetings sometimes, but we have to prioritize it to learn. All right, so next slide. So sometimes the funding agencies themselves provide resources, technical assistance, and other resources to help the organizations build financial capacity. I feel like this is a newer trend. Remember to develop and implement clear policies and procedures which are effective for financial management. Policies should cover budget development, expense authorization, procurement, cash management, and other financial controls. Templates and examples of these financial policies, or I should say templates and examples of potential financial policies and procedures, can be found through nonprofit support organizations or professional associations. And we have some links attached to this PowerPoint too that we'll make sure you guys have. So when you don't have it, I don't think it ever hurts learning from how somebody else has done it. So find another organization that's most similar to yours and see what they have posted online. And if you know someone on the board of directors or somebody on staff, ask. Most organizations are more than happy to share. And finally, remember that peer-run organizations may undergo audits or reviews. So whether voluntarily or as a requirement for specific funding sources received, understanding the audit process and having financial documentation and record keeping practices in place is going to be crucial. So it may be helpful to engage with professional auditors with experience in the nonprofit sector to ensure compliance and accuracy in financial reporting. By leveraging these resources, peer-run organizations can enhance their financial management practices, build financial capacity, and strengthen their overall organizational sustainability, which again is something that funders are looking at. All right, so here is a sample budget, probably one of the most simple sample budgets, but budgets can be simple and or comprehensive. For our organization, Paul's Plan, I had never developed a budget from scratch a day before my life, but my accountant helped us figure it out. And so even the budget that we have now isn't that comprehensive, but I also sit on NAMI National Board of Directors, and I've seen some pretty comprehensive budgets that I can't even wrap my head around because I'm like, I don't even know what all these charts and bells and whistles mean, but I'm open to learning. So starting out simple, don't negate small beginnings. We all have to start somewhere. So simple, if it needs to be simple, let it be simple. And then as you grow and as you become more equipped with working with budgets and financial management practices, your budget, I have full faith that my budget is going to be comprehensive one day. So I'll share some of my hope with you. All right. So now we will talk about a homework assignment. So one of the things that I have shared over and over again is that I wanted to drill into you guys the importance of diversifying your funding, because the healthiest organizations that I have ever worked with always have diversified funding streams. So our homework, which we're going to, when we meet again here in 2 weeks, we're going to start off with a recap, and then we'll dive into our homework assignments. What I want you guys to do is identify at least 2 to 3 new funding opportunities that your organization would qualify for, and then come back to the next class prepared to discuss. The 3 questions that we're going to ask you guys to be prepared to discuss are: how many diversified funding streams do you currently operate from? What are the 2 new opportunities that you found, at least 2 that you found, and what did you learn through that exercise? And then describe successes and barriers that you experience with during the exercise. And there are a list I will send out. We'll make sure that you guys have the PowerPoint. But there's going to be a list of resources at the end of the slide deck that you guys can use. But I'll be honest, they're mostly national, because that's the only thing that I can't list out all of the resources for every state. So you're going to have to go and do some digging of your own. But you saw the DRSS survey results of the different types of funding, state agency partnerships and stuff that are out there. So you have a general idea of where you might find some non-traditional funding. And so, yeah, that's the homework assignment, is to figure it out. So, not always easy, but we can do it. So before I get into the closing, and we've only got a couple slides here left. Before I get into that, I feel like we're a little bit ahead of schedule. So Steph or Cindy, were there any questions that you were able to track? Because I haven't seen the chat.
Yes,
Did somebody start to say something? Am I frozen?
Someone asked about the best place to start to search for local funding and local grants.
Thank you, because I didn't hear that. So I would go to your drug-free coalitions are usually I think would be the closest place, and then foundation grants. So search for community foundation grants, because there's often opportunities there. Local United Ways typically have funding that are starting to move into the social service space, into the mental health and substance use space. And then like the state departments of health would be another one. And sometimes they have partners across the state who might have funding opportunities. Drug-free coalitions, United Ways, community foundation grants, and then sometimes some of the larger factories are donating, grants to their local community, because it's just good for PR, right? So I know locally here in my state anyways, like our local Caterpillar, right? A very large manufacturing firm will donate large amounts of money to local community-based organizations. So typically, if you can at least find your drug-free coalition, they know usually the people that are attending those meetings, because they usually have monthly meetings, they know where the potential funding opportunities are, and the United Ways for sure. But I'd open that up to the group, because I know there's more wisdom on this call than what I come into this room with. So if other folks have something in mind that I haven't said yet, please feel free to either put it in the chat or come off mute and just share with the group.
We did just recently find, like you said, that large factories or corporations that have noticed things with absenteeism related to drug and alcohol use from their employees are willing to donate money for a write-off to nonprofits to help encourage recovery in the community, and will also then refer employees, and are trying to build a recovery program for the organization. So we
Brilliant.
determined that we need to start going to local factories in the area and different larger businesses and start talking with them too, since we've always operated purely from donations, even though we're trying to switch gears into grant funding. So
no, that's you're just reaffirming what I was trying to say, and I love it, because here's the other thing too, is that these organizations may also want some education for their employees, right? So you, as the community-based organization, may be able to offer some training and educational opportunities to their staff. And then you also have EAPs. There's some innovative stuff happening in this space. And I think I saw Yvette Markey join. She knows in the state of Indiana, there was our state mental health authority partnered with the Indiana Chamber of Commerce to work with employers across the state to develop substance use recovery friendly practices. So we started with their help, we started to develop policies that employers could implement, where instead of firing somebody because they failed a drug test, why don't we refer them out to treatment and develop a policy where we don't have to let them go immediately, but they have a chance to come back for a corrective action plan to keep their job, because employers are in desperate need of staff right now.
Yes, absolutely. Jamie again. Yes, absolutely.
Hi, Amy. Hi, everybody. This is Yvette Markey, and what Amy said is absolutely true. And I'm actually out in the field right now, and I'm working with someone who they are struggling with substance use and mental health challenges, and their employer is very, very, very understanding of the needs of the employees that they are willing to work with. And it's all in part to the policies and procedures that, you know, we've worked to put in place here in Indiana. So it is a huge deal, and it's really important to help employers to understand, you know, peer support services and the things that people deal with on a day-to-day basis, you know, in their struggle. So yeah, thank you, Amy, for raising that.
Thank you, Yvette, for sharing. Thanks for all you do.
Thank
This is
you.
Haley. Oh, sorry. This is Haley. I think this has been super helpful for me because a lot of the times in these webinars that I'm in with you guys, the space is held for peer services in the substance abuse recovery setting. And I know that that was the main focus of today's conversation. And it's not where I come from in our organization with peer services. We're solely focused on the mental health part. But hearing kind of where you guys search funding and how you're searching for funding is really helpful because I can still adapt that.
Right. Well, Haley, and the other thing too is that the CCBHC rollouts happening across all the states right now, you know, that's mental health focused, and then crisis services is mental health focused. So mental health and substance use focused, but mental health. So there's a lot of innovative things happening. And I was sharing with Steph and Chris, right, or Cindy, right when we joined today's call, waiting for you guys to get started for the whole presentation. SAMHSA just released their national model standards for peer certifications. So with the new SAMHSA Office of Recovery, there's a lot of stuff happening in the national federal space right now. As a direct result of the SAMHSA Office of Recovery building out their staff. So they're growing to like 12 people and still onboarding folks. And they're working on like a peer respite cost benefit analysis report to be released later this year. They're focusing on developing 16 different technical expert panels focused on mental health and substance use recovery by the end of the year. They also have they're working on, there's a planning committee meeting for here in the next couple of weeks for a national peer workforce summit. And then they're doing 3 different regionally based hybrid peer workforce summits. And I mean, so there's a lot of stuff happening in this space. And I think what's really helping bridge the gap between whether it's mental health or substance use is SAMHSA's Office of Recovery. So when SAMHSA announced their Office of Recovery, not last September, but the September before, I think it was about that time, there was a big question mark on the table about whether they were going to focus primarily on substance use or mental health. And the majority of people that I was speaking to in the national federal space, everybody wanted to see them focus on both. And I think it's been very helpful that that's where they landed, is to focus on both. So a lot of these conversations and a lot of these technical expert panels that they're pulling in are focusing on both, and it's very helpful. Sorry, I was just reading the chat and see what I missed. Oh, yes. We'll make sure that the links get shared. Other thoughts, questions, or things that people, because I know you guys have your own experiences of things that you think would be helpful for the group to hear.
I just know that I've been kind of frustrated because I've been doing this job for 22 years, running a peer-run drop-in center in Roanoke, Virginia, and finding funding has gotten more difficult. Although I did get a little bit of 50,000 ARPA funding last year, but the foundations here seem to only be funding women's programs and children's programs. It's been having more and more difficulty because our place all supports mental health and substance use issues, but we've been primarily mental health for about 18 of the 22 years I've been there. So I've been transitioning over to include both because there's so much co-occurring anyway. But that's some of the roadblocks I've found, that looking at the requirements, that has to serve just women or women with children or just children's things, so that we only serve adults. Anybody else have any thoughts on that?
So while folks are thinking about it, I'll go ahead and respond. I just wanted to give space for people to respond first, but I just put a link in the chat. So yes, so that is an issue. And I think what at least from the state's perspective, what that usually comes down to is SAMHSA priorities. So SAMHSA has their own strategic plan. I think it's a 5-year, I think it might be a 5-year plan that they develop. And they always have priorities. And so when block grant funding comes through, like when I worked in state government, this is what I'm speaking from that experience. Block grant funding would come to us, but we would have to fund it based off SAMHSA's priorities. And so pregnant women and women with dependent children and substance use was a big priority the last 2 years that I worked in state government. And so a lot of our programs and a lot of our funding were geared towards that, because that was what was written into the state budget. That being said, I'm going to empower you guys here for a minute. So each state gets block grants. They get the substance use prevention, treatment and recovery block grant, just change the name. And they also get the mental health block grant. With the block grant comes a policy, a requirement that if a state receives block grant funding, they have to have a block grant advisory committee made up of people with lived experience. And the ideal goal of those advisory councils are to weigh in and vote on where the funding gets spent for block grant spending. So if you are not aware of that in your state, I would start educating myself on who's on that advisory committee, how the voting happens, because that advisory council is the one that's supposed to be helping guide and direct and even sometimes vote on where block grant priorities and funding goes. So just something to consider.
I'm sorry, Michelle Hart here. Did you say that each state agency has to have a committee made up of people with lived experience? It's not 100% lived experience, but there is a block grant advisory council that should have people with lived experience on it. And Okay.
it's specifically tied to block grant. So if a state receives block grant funding from SAMHSA, they are required to have an advisory council. Those councils are named different things, which is the only reason why in Indiana, ours is the Mental Health and Addiction and Planning Advisory Council, and they call it MAPAC. But every state's going to have a different name.
Okay, thank you. I might as well, since I'm here. I'm from Rhode Island, very small state. One of the things that you indicated at the very beginning of the PowerPoint was that recovery community organizations, et cetera, are just fiercely competitive for any funding that comes into the state. So I worked for an agency that way back, starting in 2010, that was the only recovery community center in the state of Rhode Island. Mind you, smallest state in the union. You can drive from one end of the state to the other in 1 hour and 10 minutes, okay? We have 5 recovery community centers with not a whole lot of public transportation, except in the city of Providence and maybe a little in Warwick. They regionalized us, but when they did that, they really pitted each recovery community center against the other one. And it's really sad because the people that are affected are the boots on the ground people that do the outreach work and the people in the recovery community that are still, sick and suffering. But what we also found was that lately, and I don't mean to offend anyone, harm reduction seems to be the new and wonderful recovery pathway. And so most of our money that's coming in is going to fund harm reduction as opposed to recovery. I'm wondering if anybody else has that issue. And if you do, how are you getting around it?
Hi, my name is Trina DeFrance Dufour, and I am sorry, my camera's covered. I'm the director of the Collegiate Recovery Program at the University of Denver in Denver, Colorado. I'll add on to the harm reduction challenge, but I have 3 things. One, regarding harm reduction, I noticed we have a student population who says, I want to cut back and abstain. And so I'm serving that group. But the other students are like, I can give up cocaine, but I still want to drink. I am asking and partnering with our health promotion department because of the national conversation around harm reduction versus abstinence. So that's kind of how I'm navigating it here. I was on the board as the secretary for the Association of Recovery in Higher Ed, and we were super excited that SAMHSA created the Office of Recovery, and Christina, our ED, has gotten really involved. I'm now on our advisory council for the ARHE. And so I'm grateful to see that some of the CRPs did get funded. My challenge is there's a perception that because like we're private or any higher ed institution might have institutional funding for a collegiate recovery program as if like we don't need any other money. And I have a colleague at Virginia Commonwealth University who really maximized his relationships in the state and used like AmeriCorps and other places to get peer recovery specialists. So I'm looking for funding to support that kind of a program here. And back to the harm reduction, to help the students who are not ready to abstain completely, but they want to cut back and they don't want to follow a traditional 12-step fellowship pathway. And so I just really need help trying to find that funding. And I do serve on the consortium, which leads me to my third point. If it wouldn't have been that I knew someone who knew someone, access is limited. And I see schisms happening between different organizations like, oh, my kid wasn't an addict, but he used fentanyl once and overdosed. And so like there's different groups forming around different initiatives, and they have access to knowledge and power, and they have some access to the funding. And so we're over here still trying to like help the students. We have students who, although our tuition is very high, we have a different socioeconomic, there are many students, non-treds, that can't afford treatment. And I get money from donors, parents, to help support them. But I say all of that to say, we have a colleague who is, he oversees, I think his title is, he's a regional administrator. And I emailed him during this meeting, and he's a DO alum, and said, like, can we go ahead and have that meeting so that I can find out what are the resources? It's like, I wish there was one place to go and everything was listed and there were RFPs. That's what I even recommended for the Association of Recovery in Higher Ed. Let's have a link so that every state, every collegiate recovery program can know where to go to find out what are we eligible for. So that's why I posed that question of did CRPs, which ones, just trying to cipher through what is out there. So I hope that was a little bit helpful, but that's where I'm at, and I'm super grateful to be here.
Really good, really good stuff. Yes to all of the above. These are conversations that are happening nationally, and the responses are different depending on who you're talking to. And I can't agree with you more that we need there needs to be something nationally that has all of it listed. SAMHSA's Office of Recovery is doing a really good job of starting to coordinate some of that. I know HRSA just did a recent report on peer support billing pathways, but like it's still siloed, right? Because you're just talking about peer services. You're not talking about the whole program. So that doesn't cover admin costs. It doesn't cover all of the other things that come in play when you're talking about starting a new program or starting a new business. So just finding out how to pay for somebody's hourly wage, providing peer support isn't going to help necessarily the full business operate. So there's a lot of things, and I started to put it in the chat, and I'll go ahead and drop it in now. That link that I put in there was actually in response to what we were just talking about the funding. So in that model standards that just got released today, in that press release, it talked about $5.5 million going to recovery community organizations. And there are, and I talked about it in the White House update, there are so many more dollars right now being allocated for harm reduction. So it's just like Waltrina said, that you have to, you just have to figure out how to make it work for what you're offering. And there are a lot of different ways of doing that. You just have to figure out what's still. I would never encourage somebody to do mission creep. So you need to figure out where you fit within the harm reduction framework that doesn't take you away from your mission. Never stray from your mission to follow a dollar. I would never co-sign that. Stay true to your mission. Whatever your value is and your mission is for your organization, stay true to that. Find funding that aligns with that. Never stray. Brian, go ahead.
Yeah, hi. I have a dual major in psychology and substance abuse counseling, and I'm currently interfacing with all the organizations in my town, but I've also been researching and a former consumer of harm reduction services since 2000. So for the last 23 years, I've been on the forefront of harm reduction. And I think it's important to address Michelle. I think it's important to conceptualize harm reduction and recovery as one and the same. Because if a person has gotten to the point where they're considering harm reduction, then they are in the very beginning phases of recovery. And if we look at Prochaska and DiClemente's cycles of change, they would be what we would consider in the pre-contemplative stage. And so to speak of recovery and harm reduction as two separate entities is going to create a more stigma around harm reduction than there already is. So, and also if you're looking for grants that are, for example, something like syringe exchange service grants, you're not going to find very much. But if you look for behavioral health grants, which covers addiction, substance abuse, harm reduction, peer recovery, all of these things, you're definitely going to find something. And then, and lastly, I wanted to point out that one of the requirements, at least here in the state of New Mexico, for all peer specialists, is that they either have or currently consume mental health services, whether that be for trauma-based psychological mental health, like for example, PTSD, or whether it be substance abuse recovery. Let's not forget that substance abuse is a diagnosis in the Diagnostic and Statistic Manual of Mental Disorders. So therefore, it's doing society a disservice to talk about mental health and substance abuse as two different things. They're the same thing. They are in the same book of diagnostics. So it really a very extremely pervasive problem with the United States of America is 100 years of stigma that's built up, starting all the way back from Henry Anslinger with his anti-marijuana campaigns. And as you might have seen, Reefer Madness, that's a perfect example of a crazy stigma campaign against what we're trying to do here. So it's important for us to sort of be cognizant of how do we educate society in order to reduce the stigma, and how do we effectively find grants that are applicable to us by using cross-compatible terminology.
Thank you, Brian. Michelle Harder, and then Amanda, and then just a quick reminder: we do have to end right at 1:30 Central Time.
Brian, thank you so much for that. You know, I'm an abstinence-based person. I'm in long-term recovery, God willing, 29 years in a month or so. And you know, it was hard for me at the very beginning, way back when, to embrace all the, you know, the different pathways of recovery, right? And I've been pretty successful in doing that. The best thing I heard you say is that, and no one has ever said this to me here, is that harm reduction could be a pre-contemplation or a contemplation method. And that makes perfect sense to me. That makes perfect sense to me. What I wish they would stop doing is exactly what you said, recovery here and harm reduction here as two separate entities. As a matter of fact, in Rhode Island, the Department of Health handles anything having to do with harm reduction, but our Department of Behavioral Health, Developmental Disabilities and Hospitals handles recovery. So it's, it's separated within the state. So I think we have an issue that, maybe needs to be discussed as a whole in our Governor's Overdose Task Force, which is another conversation for another time. But I just wanted to say thank you for that, Brian.
I mean,
Really
let's face it. I challenge you to find a single person who did not start tapering before they got into the abstinence model. Very, very few people have
Just quit.
Harm reduction is a necessary first step to getting to abstinence. It's just, so for legislators to fail to realize this is kind of an oxymoron. It's kind of a so I don't know.
But thank you. It's the best thing I've heard in weeks, actually.
You're welcome. Thumbs up.
All right, Amanda, you're up. And then I thought I saw Jamie's hand. So Jamie, if you still want to share, you can go after Amanda.
I kind of wanted to go back to what you said about staying true to the mission. So I'm a family peer support in New Mexico, and we have been discussing, we don't have any family run organizations for family peer support right now because everything is being funded through the state, and they've put like satellite offices and or satellite people in like different system of care grant organizations. And we're trying to restart the family run organization that we had originally. And we've been trying to, we've been discussing like expanding that to maybe more than just the original mission, because we are having trouble like funding specifically family peer. Like that is, I don't know, like when there's like absolutely nothing that you can find to do funding. I don't know. We're wondering about partnerships, maybe like with like Youth Peer, and like trying to maybe partner with like substance use, also that kind of thing, just to create like more robust services. Maybe, I don't know.
Did you say you're in New Mexico?
Mm-hmm.
So I have some insiders in the state of New Mexico. So maybe you and I should connect offline, because I might have some resources for you. But it is along the same vein. I did want to share with you that in the state of Indiana, we had not historically had family parent peer support either, in terms of a certification, a program, funding, even Medicaid services billing as an option. It was just not part of our infrastructure. And so we are just now starting to build it out, and a lot of states are starting to build it out. So if you look at the Peer Recovery Center of Excellence website, which I don't know if Steph can get it in the link in the chat fast enough, but if not, we can send it in a follow-up. They did a comparative analysis on states' peer certifications, which then helped inform the model standards discussion, which the final version just came out. When SAMHSA released that draft for public comment, they got 200 comments. The primary one that they heard back on was the need for separation of family and youth in all of the certification model standards and recommendations, because they were being lumped together and they're two independent services and they should be treated as such. So that's just one thing to consider, is that there's more and more resources coming out. And I know that the Federation for Families nationally just released, maybe just is a little bit too aggressive, but within the last year released a national family parent peer certification that's offered for free online. And so there's tons of resources. So the thing is, I am the biggest proponent for, if it's not in your state and you know it's a need, that's room for opportunity. Step into it. Somebody's going to have to step into it and own it. And until you do that, it's just not going to happen. So there's lots of stuff out there. I'm going to put my email in the chat for my day job. Send me an email and I'm going to send you some resources to hopefully help you push through that barrier that you're having.
Thank you so much.
Mm-hmm.
Hi, it's Jamie.
Go ahead, Jamie.
Okay, I just wanted to, I was having a lot of thoughts when Brian was sharing, and I really appreciate everything he said. It definitely, they're not two separate entities. That's for certain, SUD versus mental health. And we do see a high percentage of co-occurring with many addicts and alcoholics, wanting to or being pushed to get sober. And I think that the question about which needs to be addressed first has always been the big debate. Do we work on detoxing somebody and then worry about giving them a diagnosis a year into recovery? Or do we initially address mental health symptoms or psychosis that could present by because of drug and alcohol use? So all that was coming to mind. And then when I received my peer certification training, I was hired into with our county's community mental health as a peer support specialist level 1. That's how they do it in the state of Michigan, level 1 or level 2. And there was no equivalency with a peer recovery coach and a peer support specialist, but the peer support specialists were utilized for mental health, not substance use disorder. So I was in the beginning stages of when our state was fine-tuning all of that and approving equivalencies. And then when all that finally did happen, it took, I don't know, a year or so from me getting my training. But my point is, a lot of the peer support specialists that have been employed and previously trained weren't necessarily trained with the stages of change. And even those coming in that didn't receive peer support certification training, that was something I tried to offer a couple times a year at our staff meetings. Because when you can't recognize what stage of change a person is in. I just think that's a huge necessary tool. And that ties in the harm reduction also, and the fact that detox is a form of harm reduction. And so again, if we're stigmatizing pathways, there's enough stigma. So like I said, I'm rambling, but it was just a lot of thoughts that were flowing through my head. And I think also with separating youth services and family services for so long, home care and home visit services provided by, say, community mental health always looks at if the juvenile or youth is the one who's been referred and receiving services. It also includes the entire family, though, is then receiving services because of all the relationships tied to the youth. So it can get sticky, but yeah.
Right.
Thanks.
So no, thank you, Jamie, for everything that you shared. So one thing I did want to point out, and then John, I'm going to call on you next. So last week I was part of a SAMHSA small panel discussion on a new report that's coming down the pipeline. So SAMHSA is partnered, the Office of Recovery is partnered with the Center for Finance, Reform and Innovation, CFRI, I think it's called. And what they're doing is they're putting together a national report of existing Medicaid reimbursement rates for every single state, along with the utilization rates for peer services being billed within each of the states. And so they're making some very clear recommendations in there. And so I think if I remember correctly, it's a huge, long, like 30-page report. But if I remember correctly, it even lists out the family, the youth, the adult, all of that is like separated. So there is still more stuff coming down the pipeline, even by the end of this year, that I think is going to address everything that's come up in this meeting so far, except for maybe the universal spot to find all of your funding opportunities. But we can work on that. John.
I'm looking at the time. I'll be quick. So thank you so much for the topic today. I'm only 1 year into my nonprofit, and I'm any help I can get. Thank you very much. You did remind me that there is the opioid abatement money I think each state has right now. I don't know if you have suggestions that maybe some of the people that spoke here today might look into that or qualify for that. But I specifically, before we got off, Waltrina on the screen, I would love to connect with you. I didn't want to get off this meeting without asking. I did send you a message. I live in Colorado too, very close to where you work. Please tell me yes that we can connect. Thanks. That's all.
Shameless plug from John over here. No, the funny thing is I connected that with the Colorado. And the reason I thought about that is because our NAMI National Conference, we nailed down for Denver, Colorado next year. So I'll be in your guys's neck of the woods myself next year. So I noted when she said Denver, Colorado, and then John's like Colorado is on his name. So okay, so I know we're down to just a couple minutes. So just a very quick reminder, homework assignment. So we meet again in 2 weeks. You are, by virtue of registering for this event, you are already registered for the next event. Steph, correct me if I'm wrong. And then homework assignment for that is to identify at least 2 to 3 new funding opportunities. And we will follow up this email with a list of resources. And there are resources in the very last, I think it's the very last the very last slide in the slide deck. So, or it's near the end, it's before the questions. So we'll make sure you guys have everything that you need. Steph, any final closing remarks? Nope, she says you'll have everything that you need. Thank you guys so much. This has been great. I'm so glad we have time for discussion today because last time we ran right up until the end and I didn't get this interaction and I loved today's interaction. So thank you so much. And I look forward to seeing you guys in a couple weeks.